Shutdown or not, essential workers can't stay home. They're processing the food we eat and making sure other people get what they need to survive. But doctors insist most provinces still aren't adequately protecting those workers from this virus, and the situation is getting worse.
They're ending up in the ICU. They're staying longer in the ICU. We are seeing a changing face of who is getting COVID-19.
Researchers in Ontario revealed today communities with essential workers have seen a 51% increase in infections due to more contagious variants. And researchers outlined another problem.
We are not vaccinating more in the highest risk communities. You need to make sure that it gets where it's going to have the biggest impact.
So they're unvaccinated and don't have access to paid sick leave.
Before going to medical school, Dr. Preet Brar worked temp jobs in factories. She says low-wage workers need help. Toronto Public Health data shows over 60% of workplace outbreaks have been in industrial settings like food processing and warehouses. But Brar says the province won't offer any detailed data about who got sick or the companies.
If you have no data to work with, you're kind of lost, and really no one understands the problem, and how can you address a problem if you don't really understand it, right?
Doctors say what they do understand is that variants are spreading and workers need safeguards, including paid sick days, access to vaccines, and paid leave to get their shots.
Our governments have the answers. We must protect them. If we do not do so, we are being irresponsible.
Essential workers like Louise Boltby enjoy their jobs, but the risk of becoming infected can be overwhelming.
I think we're really, really tired, and I think many of us are, it would be wonderful to have the vaccine.
For her and so many others, better protection can't come fast enough. Christine Birak, CBC News, Toronto.